Please.
And Dr. Wilson, thank you for inviting me. Like you said, I am a treatment nurse. I work at Toronto Western Hospital, and in the next 10 minutes, I'll tell you what a frontliner thinks beyond the medication is needed to successfully treat our patients. So I'm going to start with just a brief overview of how our landscape has changed in the last year, I would say. Cost of the treatment, I'm not going to get into that. I think we're all aware how expensive these medications are. But what is also important, our patients don't really know how to navigate the healthcare system. They don't know how to navigate the insurance system. So a quick example could be one of our patients that called up insurance company and said, hey, do I have coverage for this medication? And we're talking about sofosbuvir and simapravir last year. The insurance agent said, yeah, you are at 40%. Comes back, he says, I can't afford that. With the help of the patient support program for one of the companies, they were able to contact the insurance company again, and it turns out that he has coverage up to 40%, up to $1,000. But yes, and the rest of the treatment was 100% coverage. The problem is, if you don't know what to ask, you will not be able to access these medications because you think, oh, I don't have any coverage. So that's one of the things, apart from just the cost of the treatment, that I've been seeing a lot. Provincial funding and private funding, I mean, it's still an issue. There are all kinds of rules that we have to, obey, and it is limiting our patients in receiving these drugs. I don't want to get into that because I think the whole day we've been hearing this. Personally, we're being flooded by insurance forms, and they have to be really filled out properly. Otherwise, patients will not get treated because they will be denied. Side effects. If you asked me about a year and a half ago, how much time do you think you're going to spend on managing side effects? I would have said probably nothing. Unfortunately, we're prioritizing patients that are sicker. So things that you read in the literature about Sovaldi-based treatment, that little constipation issue with patients that have encephalopathy, they're being admitted when they start treatment. For the first couple of weeks, we've had a few patients that had actually ran into trouble. They usually do get in touch with us, and one of the first things that I've heard, one of our patients just got admitted, the recommendation was to stop his sofosbuvir and ledipasvir treatment because it's probably causing the confusion. That's not acceptable with a treatment that's $70,000. And patient support programs are becoming a necessity for us. I cannot possibly deal with all the insurance issues that we dealt before. So they do take a lot of pressure of everyday sort of work that I do. Now, let's talk, it's not going forward. Oh, here. So let's talk numbers, because up to now I've been pretty much whining. But during the interferon treatment sort of era, I would treat about 50, maybe 70 patients, up to 70 patients per year on ongoing sort of basis. We got 360 referrals last year alone, and I do keep track of it right now, just so I can tell you all about it. We are one of the top 3 treatment clinics in Canada, and those are the 360 patients that I got last year. Those people are the ones that we knew they have insurance. I'm not seeing the ones that have public funding. This is just the ones that do have insurance. So out of that, we were able to treat only about 160. Everybody else were denied coverage. Now, right now, things are getting a little bit better. A lot of the insurance companies are more open to paying for things like Harvoni. We started about 40 people last month. But when you look at the referrals that we're getting, those 200 people that never received treatment, they're still on my list. We are trying again to get them coverage for treatment. Additionally, we're getting about 10 to 15 patients per week from our physicians. There are 5 physicians that I work with. And we also get self-referrals where patients would just call me up and say, hey, you treated my buddy and he's cured. Can I get on this treatment as well? So of course, there's a whole process for that as well. But when you put it together, we have about 3,000 plus active patients, Hep C patients, and I frankly cannot treat more alone by myself, more than 300 with all the forms, with all the issues that pop up. So with the 3,000 patients that we have, you can see how long it's going to take us to get through our load of patients. Okay. And just so you know, there's 1.5 of a treatment nurse and 5 physicians that are doing all this. Now, why do we really need even nurses or coordinators? Why can't you just write a prescription and the patient will go off? Well, adherence is and will be an issue, especially with public funding. Just ask yourself, when was the last time you actually completed 10 days of antibiotic that your doctor might have prescribed to you, especially if you have to take it more than twice a day? The same thing will happen with patients. Once there's public funding for these treatments, people consider it free and might not, if you just give them prescription without additional sort of education, you will find that patients are not taking their medication, 1, correctly, 2, to the full course, thinking, hey, maybe I can get away with just 8 weeks instead of 12 weeks. So adherence is something that we deal with and we will be dealing going forward. I think it's our responsibility to ensure that patients understand what their responsibility continuity of care. If you were to just write a prescription and give it to your patient, chances are they will never come back for a follow-up. And majority of our patients are cirrhotic, which means if they assume that they're cured and they don't have to do anything anymore, they might not even come back for follow-ups. This is happening right now. People think, oh, I'm done, I don't have to come back. So you really want to make sure that there's some continuity of care. We do still manage side effects. That's not going away, especially with the sicker patients, like I mentioned. And education. I think educated patient is less likely to stop their treatment early. And you do need somebody doing that. So, what's this? So the take-home message for the short presentation is that really without dedicated personnel, people overseeing this whole treatment period, you're really... at this point, I am the obstacle to becoming an obstacle to care. I'm very, very busy, and even the patients that might have coverage, they do have to wait for me right now. We do need extra stuff. We don't have funding for it, and I think we should really be looking towards government funding. It is a public health issue. We got used to, pharma funding in the past, and I think we're moving into a completely different era right now, where government should be really looking into helping treatment centers like us to get through this volume of patients. Okay. And that's about it. Any questions?
Any questions? Do you have a peer support program?
No, we don't. We tried years ago, we tried to get one together for patients that were on interferon. We thought it would be beneficial. We've ran into a lot of people saying, I really don't want to disclose that I have hepatitis C because of the stigma. So our attempt, the initial attempt, really didn't work that well. We are looking into more sort of an education group where people can meet up and sort of exchange ideas with our help, where we can teach them about how to access, insurance system and, where to look for resources.
Yeah, I've been involved with one, and I know, like, going through the interferon treatment, some structure around that was beneficial for a lot of the patients.
Yes.
In getting out at least once a week and having somewhere to go.
Yep.
But a format I find, like, developing maybe a universal, or let the group develop their own format.
Yes, we are considering that right now. We were thinking a support group in a context of we would put together an education program, and then whoever is interested, maybe we can form a support group with those patients. So we did look at it, but in the past it didn't really work that well.
Oh yeah, and supplying nutrients, food also is a good benefit.
I see where you're going with this.